Hi everyone, today I am giving you information on the topic astigmatism. So let's move to its description. A variation of power in the different meridians of the eye. So it is a different condition. So let's see. It is a kind of condition in which the parallel rays of light coming from infinity, they get focus at the points, different multiple focal points. Some of them are in front of the retina, some of them are behind the retina, but any of the point doesn't focus on the retina. That's why the person is not be able to see any clear image, because different multiple focal points are formed in this case. Next one, causes. The causes are basically related to two things. First one is the cornea and the second one is the crystalline lens. So the cornea at the time of the birth, it is against the rule. At the adult age, it is with the rule, and in the elder, it is against the rule. We'll discuss it later. Next one, what are the causes related to the lens? Lens may be tilted due to its position. The normal position of the lens will not be there, the lens will be tilted. Difference in the thickness of the lens. For example, if any kind of refractive index changes, early cataract changes, so there is a difference in the thickness of the lens. Eccentric fovea. Fovea is not present at the center, it may be at the different position. Fundus irregularity. Any irregularity in the fundus may be seen, it leads to the astigmatism also. Next one, classification component. So on the basis of classification, it is with the rule. So according to with the rule, greatest power lies in the vertical meridian. Okay, so the greatest power lies in vertical meridian, means the person has the astigmatism from 60 degree to 120 degree. Now, as we all know that in case of cylindrical lenses, at one where the power is 0, on the one meridian there is a power, and another one is the axis meridian. So if the patient has with the rule astigmatism, then it will be myopic power. Myopy means minus cylindrical power may be given to the patient if it is with the rule. Next one, against the rule. If it is against the rule, then greatest power always lies in the horizontal meridian, and we will give the myopic power in the horizontal axis. Okay, greatest power lies in the horizontal meridian. Next one, oblique meridian. In case of oblique meridian, the total astigmatism consists of the cornea as well as internal lens, because the astigmatism is just because of both the things, maybe due to the lens and maybe due to the cornea. Corneal astigmatism is due to the anterior cornea, means outside the cornea, exposed cornea, and internal astigmatism is due to the posterior cornea, lens and the retina. Okay, corneal astigmatism is just due to the cornea, which is anterior cornea. Internal astigmatism may be due to the cornea, due to the lens and due to the retinal changes. Next one is classification on the basis of regularity. Now regular astigmatism is at the 90 degree or 180 degree. Okay, both the principal axes are is at the 90 degree angles to each other, maybe 90 or 180 and maybe 45 degree. Both have a 90 degree difference in between them. Next one is irregular astigmatism. The curvature of one meridian is not uniform. Okay, so there is no 90 degree difference, it may be anywhere. Next one, causes of irregular astigmatism. Now it's related to, first of all, see the corneal causes. Injuries to the cornea, any kind of injury to the cornea, for example foreign body, maybe entry to the cornea, corneal opacities, any kind of congenital opacities. From the birth there is a opacity on the cornea which can cause the astigmatism. Wherever the curvature get disturbed, it leads to the astigmatism. Next one, pterygium. Pterygium is a kind of condition in which the triangular mass comes over the eye. Next one, wound healing. While healing of a wound, okay, when the person have SICS, small incision cataract surgery, there the incision is given to a patient which give birth to the astigmatism also. Due to the wound healing, there is astigmatism. And after the foreign body removal, after wound healing, maybe it cause of the astigmatism. Next one is keratoconus. It is a kind of corneal disease in which the cornea becomes bulgy shape and more steeper than the normal. Thinning of the cornea, but it become bulgy. Next one, lens. Irregularity, inequality in the density. Density of the lens changes, refractive index of the lens changes. In the early cataractus changes if the person have nuclear sclerosis, posterior subcapsular cataract, cortical cataract. In any kind of cataractus changes, the lens become disturbed and there is an inequality in the density, because in the different parts of the lens the cataract occur. Cortical cataract occurs in the cortical area and nuclear sclerosis occurs at the nuclear area. So in this way they get affect. PSC occurs in the posterior chamber, ASC anterior cataract occurs in the anterior chamber. So the part of the lens get disturbed, so there is an inequality in the density. Deformity, deformation of the lens. Coloboma, coloboma means triangular tissue get missing from the lens. This is a condition in which there is a lens coloboma, triangular tissue is missing. Subluxation means the lens get moved to its position. Subluxated lens means it get come out from its position. Tilting, any kind of tilting to the lens due to the trauma. So all these cases give birth to the astigmatism. Clinical classification on the basis of refractive error. Now, simple myopic astigmatism, simple hyperopic astigmatism, compound myopic astigmatism, compound hyperopic astigmatism, and mixed astigmatism. All these are classification which are based upon the refractive error. First one is simple myopic astigmatism. In this case, the only negative cylindrical component will be present here. Okay, so as we all know that this one is the spherical component which is written first, and this one is the cylindrical component which is written at the second position. And in always the cylinder consists of any kind of axis, maybe 90, 180, 20, 120 degree, any one. And in spherical there is no axis. Spherical should be written first and cylindrical should be written second, and in between there is a slash which differentiate the spherical as well as the cylindrical component. So in case of simple myopic astigmatism, there is only cylindrical power and the cylinder should be in minus, which is known as a simple myopic astigmatism. Let's move to the next, simple hyperopic astigmatism. Here is only positive cylindrical component is present. Okay, so the spherical component becomes plano and the cylinder always comes in plus power. Only cylinder is present, no spherical power. Next one, compound myopic astigmatism. In case of compound myopic astigmatism, both of the components are present, cylindrical as well as spherical. Okay, for example, but it is a compound. Compound means both are present, spherical as well as cylindrical. Myopic means both are in the minus. So as you see in example, -3 with -1 at 90 degree, both are present but always in minus. So that's why it is a compound myopic astigmatism. Next one is compound hyperopic astigmatism. In this also both the components are present but maybe in plus. So here it will be plus. Okay, +3 with +1 at 90 degrees. Next one, compound myopic astigmatism. In case of compound myopic astigmatism, both the components are present, one in plus and one in minus. Okay, so -3 with +4 at 90 degree is a compound myopic astigmatism. Next one, what are the signs and symptoms of astigmatism? First one is asthenopia. The patient has tiredness, heaviness on the eyes, distortion of blurry vision. Okay, so the vision becomes distorted. In the astigmatic patients can read the different letters. For example, if there is a B, then they will recognize it a D. If it is a D, then they will recognize it O. Okay, so there is a blurry vision or the distortion vision. They can look by the half closed eyes. We will squeeze the eyes and see what is the letter. Head tilt may be possible. Wherever the axis will be there, they will tilt their head and then read the letters, adjust themselves. Correction is given on the basis of glasses may be given to the patient. So plus glasses are available for giving to the patient for astigmatic patients, cylindrical as well as spherical power. Next one is contact lens may be given. Contact lens are available till -3 to -4, and some companies are there which can make them -5 or -6. So not more than that contact lens are available. Refractive surgery, it is also possible till -3 to -4. Okay, so there are some conditions under which these things can be treated. Next one, or we can say that we have limited options of treatment for the astigmatism. Next one is assessment. How can you assess blurring of vision? Patient will say blurring of vision, asthenopic symptoms, distortion of images, head tilt, diplopia means double vision, family history of squint, patient have the family history of squint. Next one, glasses or the amblyopia. Amblyopia is a condition in which the one eye becomes a lazy eye. Vision of the one eye is more and the another eye is less. Next one, examination. How can you examine? First of all, take the visual acuity of the patient. In case of visual acuity, you will get to know that the person is reading the different letters. Like he can read the D to O because both are same. This one is D and this one is O. So he or she is not be able to recognize is it D or O. B and D creates confusion. P and R create confusion. O and Q creates confusion. So they can read the letters like this. C and O creates confusion. Next one is pinhole examination. By taking the pinhole vision, you will get to know that can we improve the patient or not. So what possible conditions are there so that we can increase the vision. How can we increase the vision? Next one is refraction. Refraction, we have to do the proper refraction. Can use the JCC, Jackson cross cylinder, while doing refraction. For the spherical refining, we can use the duochrome, and for the cylindrical refining, we can use the JCC also. Axial length may be checked because the retina is also involved in it. Next one, cycloplegic refraction. We can also take the cycloplegic refraction because somewhere the plus spherical power may be there as well as the astigmatism may be there. So if the patient has plus spherical power behind it and the patient is young, so he or she is not be able to accept it directly. So cycloplegic refraction is again very important. Anterior segment examination for looking out the keratoconus for any kind of abnormalities like corneal opacities, leukorrhea, different conditions which are related to or different diseases which are related to the cornea. Posterior segment examination is again very important for looking out the axial length. So this is the examination pattern. This was the end. Thanks for your patience.